Importance of patient interaction as a paramedic. This summer, I shadowed a paramedic who worked at the fire department in my town, Easton, Massachusetts. I completed about 35 hours. Throughout my experience, I observed a wide array of situations, ranging from minor to more severe, such as broken bones or minor complaints of pain, to heart attacks and overdoses. Aside from administering drugs and giving medical attention to patients, I found that the other most important aspect of a paramedic's job was patient interaction. This factor involves incorporating multiple techniques such as communication, reassurance, and eye contact in order to decrease the overall stress of the patient and any family or friends of the patient. Patient interaction is so important and is something I will encounter in any medical profession in the future. I was able to talk to my mentor and his team about the importance of patient interaction and what they do specifically to calm the nerves of the patient and/or family. I observed that quick decision-making as well as critical thinking and evaluation were crucial in order to handle each situation accordingly and reduce the stress and nerves of each and every patient. Through talking to my mentor and through my observations, I learned that every patient is different and will require a different amount or kind of interaction. In order to reduce stress and worry, some patients will require more reassurance, attention, and sympathy than others. Paramedics are dealing with people at their worst or most scary situations. Therefore, it is so important for them to handle the situation accordingly and decrease the anxiety and stress of the patients and possible family members involved. One particular experience that stands out to me is when I observed my mentor and his team dealing with a 7-year-old boy who had fallen off a water slide. The boy had a broken arm and was crying next to his mom, who was hysterical. My mentor immediately scoped out the situation and noticed a hysterical mother. He noted that the boy's state was not severe and that he had time to go over and comfort the mom and the child. He told her exactly what would happen to her son and that he would be okay. The boy seemed shy and scared and would not look up at my mentor. My mentor noticed his tense state and crouched down to the boy so he could be at his eye level. He comforted the boy and explained what would happen to him. He also allowed the mother to sit next to her son during the ride, which helped to decrease the stress of both the mom and the child. Throughout the duration of the ride, my mentor continued to talk to the boy using simple language, which also helped to make the boy less anxious. Such an unfamiliar event can be overwhelming for children. Therefore, it is important for EMTs and paramedics to decrease the stress of these types of patients through communication, reassurance, and other small gestures. Another situation that I experienced dealing with decreasing patient stress falls into the opposite extreme. Rather than a hysterical mother and scared young boy, the patient was a man in his late 20s who had just been in a drunk driving accident. The man was not in critical condition and seemed to just have a minor head injury. He was in a high state of distress and was freaking out to my mentor and his team. He did not have a clear recollection of what had happened and was speaking angrily to my mentor. My mentor recognized his anxious and paranoid state and approached the man calmly. He spoke slowly and clearly explained what had happened and what he suspected to be the extent of the man's injury. My mentor avoided discussion that could make the patient more angry or more stressed, such as highlighting the man's drunk state or criticizing his actions. This gesture helped to calm the patient down and get him into the ambulance for transport. Unlike the young boy and his mother, the patient did not seem to want discussion during the ride, so my mentor kept this type of interaction slim. His team also turned the sirens off, which helped to further calm down his patient. He also dimmed the lights, furthering the decrease of stress. For both of these situations, readings such as heart rate as well as obvious observations of the patients helped to verify if the patient's stress level had decreased. In both of these situations, the patients had a significant decrease in stress, exemplified by a decrease in heart rate, as well as body signals such as a less tense body posture and normal breathing. For any medical situation, patient care and interaction is the main focus and goal. Therefore, reducing stress and anxiety of the patients is a big priority. Critical thinking and decision-making skills, as well as the application of scientific knowledge, are main factors in achieving this. My experience this summer was so valuable to me as it allowed me to observe emergency medicine, as well as the many ways paramedics interact with their patients to calm their nerves and decrease their stress.